Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Welcome back to this week's episode of The Feds, where we seek truth. I am Stephanie Weidle. Before we begin, well, by now you can probably say it for me. Please like, comment, subscribe to, and share our podcast. Visit our website where you can learn more about the Feds for Freedom's mission of holding the government accountable and protecting Americans from government overreach at fedsforfreedom.org. We've recently put up all of our Medical Freedom and the Constitution Summit videos on our website, so be sure to check that out. Anesthetist and perioperative physician Jeyanthi Kunadhasan was fired over the COVID-19 vaccine mandates in Australia. She became part of the international group of researchers to look into the publicly available Pfizer data that was used to approve the Pfizer COVID-19 vaccine. And what she and her team found was disturbing. Most of the findings were printed in Naomi Wolf's Pfizer papers. Jeyanthi, it's a pleasure to have you. Welcome. Thank you so much for coming.
Thanks very much for this opportunity and lovely to meet you, Stephanie.
Thank you. Jeyanthi, you are an unvaxxed physician living in Australia. That was one of the worst countries when it came to the COVID tyranny. I mean, you couldn't be in society and be an unvaxxed person. In fact, people were put into camps there if they were unvaccinated and perhaps tested positive. What caused you to refuse the COVID vaccine, and what was the reaction of your friends and family and coworkers?
So it was very traumatic. So basically, why I just couldn't believe, as a medical profession, we had taken it upon ourselves to force an experimental or any treatment for that matter, even if it wasn't experimental, that we would be behind mandating a treatment for the entire population or anyone. Like I just could not believe that I'd come from a third world country, come to Australia, and then suddenly I'm a physician standing up for informed consent, and I couldn't get informed consent. Like I have 4 medical degrees, and all I asked my previous employer was a risk assessment, justify this treatment to me. Let's do the risk of me dying untreated from the disease. It was less than 1% for my age group. And that's untreated. And let's just go through the risk of this treatment, which is new, and they wouldn't have been able to elucidate any long-term treatment. So basically, my previous employer, after years of loyal service, just basically fired me. And so it was very, very traumatic. I was basically my previous colleagues just pretended they didn't know me. There was very little eye contact. Everybody pretended like I didn't exist. Even when I got fired, like I couldn't go back to work and get my belongings. And what they did was they just basically packed everything, put it in a box outside my house and said, we've delivered it. And so friends as well, I lost friends, but I made a lot of good new friends through this experience. So basically, my family was supportive. They were quite concerned. But, I had already, by that time, I had I had spoken to anybody I could, what I perceived to be the harms and the risk involved in it. So people knew where I was because I was already, basically telling my family members this is what you should be doing and stuff. So, and all my colleagues knew where I stood, and there was a opportunity to get a fake certificate, and I couldn't do that. I couldn't bring myself to walk in because for me it would be a lie, and like the worst lie would be to the patients because they would assume if I were at work the next day after the mandates came in that I was a vaccinated person. So yeah, it was very traumatic. It was not, especially if you're a doctor and you're not doing it. I have colleagues and friends who their medical licenses have been taken away, and they're still fighting to this day to actually reinstate their medical license. So dissenting as a doctor in Australia during COVID has been a extremely traumatic experience that has basically cost those who dissented, cost us financially, emotionally, every way.
Well, it's incredible that suddenly all of the COVID tyranny seemed to end in a way.
Yeah.
Retaliation still has continued in many ways, but what has continued on there? Have there been new medical procedures that are being forced on the population, or anything else that is being forced?
Well, I think in certain states, so the thing is that when they brought in the mandates, and then when they actually slowly brought the mandates down, it was actually happening at a different pace in different states. So it was, certain states brought down the mandate requirement earlier, and some states just kept it on like years. For 1 or 2 years longer than the other states. So as a medical professional, I couldn't work where I lived in Victoria for a long time, but I could go to another state in Australia and work. And since then, like in other states, they have one state's actually enacted that they can vaccinate you against your will. I think, and yep, and then so other states have, even though for healthcare workers, they have taken away the requirement for COVID-19 vaccination. The flu jab, which has negative efficacy this year, I don't is a mandate. So it's actually quite sad for me, because I'm wondering why all these healthcare workers are allowing these mandates to stand. I mean, if you look at the evidence shows negative efficacy. So why would you allow something to be mandated that has negative efficacy, as for the healthcare workers? But obviously, COVID and the draconian measures that were enforced has also enforce a certain compliance in the population of workers that still stay. I think people saw us being fired, and we were being fired to make an example of. And never mind that they took away my permanent job, and then a few years later rescinded the requirement. No apology, nothing. But it is what it is. As I said, the cost has been. If you're a doctor, a physician, and that will be around the world. There's lots of doctors in America who've actually paid a very big price as well. The cost has been high. Yeah.
Mm. Well, after Aaron Siri and the Informed Consent Action Network of the ICANN, a lawsuit resulted in the Pfizer documents being released, which Pfizer wanted to keep under wraps for 75 years. You became part of an international group of researchers that combed through the publicly available data. What were you all looking for?
So basically, these documents form the basis of Pfizer's COVID-19 vaccine approval. And as you said, that they didn't want it. So I think Pfizer wanted it not known for 50 years. The FDA wanted 75 years. So obviously, there must be something amazing in there that.
Yeah.
And it's more than 500,000 pages. They say 500,000 pages, but there's like probably more than 500,000 pages. And
And
not one person could read it. So
was it as amazing as you all were hoping it would be?
well, yeah, I don't know whether it was amazing. I don't think the papers were, the data's amazing. The data's interesting. And what is amazing is the team that's come together to look at it, and the international effort. So based, not one. So the amazing thing is how the team formed, and they're not all medical, and but we had a collection of people, and basically the motive is to find out what's in it for the benefit of humanity. And we put in a lot of hours, and it's all volunteer. So and basically that's the amazing thing. Like, the data is the data. What is amazing is the way they try to hide the data. So the way that the data would come out. So our data team's amazing in the sense that they made it into a format where the researchers could actually examine it. But the way they presented the data was to make it especially hard for you to even be able to sieve through the data. So
Mm.
even though they had to, the judge said, no, 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 you got to show it, even though, and everything, because, the team that I'm part of, we ended up writing a paper that's been peer reviewed in the journal. Everything that we did, the information was put out piecemeal. They put out a bit, and then like a month later, they put out a little bit. So you had to be at the watch for it, and you had to be able to thread it together. So, even though they put out the data, it's not like they were putting it out and like, here it is. Nothing was handed on a silver platter. You had to really decode it.
Before we get into what you found in
Yeah.
the Pfizer documents, I just want to ask, and I'll probably ask again at the end, why do you think they were trying to hide it?
Mhm. So what I found was, at the point of the vaccine approval, when Pfizer said, we've conducted a trial of this many participants, and at this point, 6 people died. I found actually, and I'm part of a team that found this, there were actually more people that died than they publicly disclosed. And we'll go into that when I talk about it further. And the other thing is that, think about this. The other thing that I found was, President Trump really wanted a vaccine before the election. And there's a contract that actually stipulates they had to deliver a vaccine by the 31st of October 20th, 2020. But what I found is Pfizer publicly underrepresented how many cases they had. And what they said publicly really differed from what they had privately. So, in the sense, I'm saying Pfizer withheld vaccine efficacy data around the time of the November 2020 election. And if you think about deep state, this would be a pretty deep state, because obviously they couldn't do it themselves. But it's, what I felt during the pandemic was medicine got so politicized, it became poisonous. You know,
Yes.
it made everything so poisonous that doctors couldn't actually even treat patients properly, and the whole ivermectin thing and the demonization of ivermectin, that was insane. But because it became a poisonous atmosphere. And so now you have underrepresenting of data where they could have actually said, we have enough cases, we can test this vaccine and say it's efficacious, but they suppressed that result. So if you were involved in that, you probably don't really want people to know for 75 years.
So
Maybe.
you think they were withholding data that perhaps could have helped Trump win the election
Yeah, I'll
in
show you. Yeah.
2020, just kind of push his numbers over the edge, and yet they withheld that data until after the election.
Yeah, yeah. I'll show you. I'll show you what I mean. Yeah. So
Okay.
so that's probably why they didn't want this data out, because if it, hiding debts is pretty bad. And then, trying to sway an election is pretty bad.
Right. Well, let's get into what you actually found.
So basically, the first thing, so I'm part of a team, and we're team 3 when we were with another group, but now we're in the pandemic investigation project. And we had a peer reviewed paper, and we basically looked at the deaths in the Pfizer trial. So the Pfizer COVID-19 trial was actually reported in the literature twice. So the first one is when they provisionally approved the vaccine, and that was in December 2020. And then the next one was, they call it the 6-month data, and they reported that actually the data they collected somewhere in March, April, but they actually presented that data in September. Now, why we say this is the hidden deaths in the Pfizer COVID-19 trial if this was published in December, the December issue of the New England Journal, Safety and Efficacy of the Pfizer COVID-19 vaccine, they basically said there were only 6 people that died in this trial at that point. So people have to understand, when they actually approved the vaccine, the trial was ongoing. They hadn't completed the trial and then looked at the data. So when they had a cutoff date of November 14th, and then Pfizer actually sent the data to the FDA November 20th, and then they had the meeting to approve the vaccine on December 10th, and then they actually approved the vaccine December 11th. So at the point of this point, they said only 6 people died, 2 in the vaccinated, 4 in the placebo. This was considered up to the data cutoff date of November 14th. And also look at this sentence. This is from the journal. No deaths were considered by the investigators to be related to vaccine or placebo, and there were no COVID-19 deaths as well. So just to reiterate, at this point, this is actually presented on the December 10th meeting. They said there were 6 deaths, 2 vaccine, 4 placebo. And now, this is the journal article we published. When we say there were 38 deaths, this is the 6-month period. So remember, I said there were 2 periods where they published their data. So this is the 6-month period. But when we look at this, and we got all this data from the publicly available, 500,000 pages, and very convoluted. Like, it wasn't just one piece of paper and you find this. So it had to be sort of reconstituted. But what we want to pay attention to is look at the data cutoff date of November 14. So remember, they said 6 people died. Each bar is 1 person. And if you just count this is way more than 6. So there's something wrong here. There's a trial going on, and there are more people dying than they can keep track of. Do you get me? Do you understand what I'm saying, Stephanie?
Do we know if they were unvaccinated or vaccinated?
Yep. So I'll get into that now. So this is the B and T group. So that's the vaccinated group, and this is the placebo group. So we'll just this as our peer-reviewed paper. You can find it here, and we talk about the up to the 6-month period where there are 38 deaths. But up to the period of November 14, remember what they presented was 2 vaccine. But actually, if you look at here, it's 1, 2, 3, 4, 5, 6. So there's 6 vaccinated deaths, but they only managed to find 2. And in the placebo, there was actually 1, 2, and there's actually 3, 4, 5 here. So there are 5 deaths, and they managed to have 4 that they reported. And if you look at the graphs, they sort of overlie each other. It's not like taking the vaccine saving you from dying, if you know what I mean. And then ultimately, in the end, you had more deaths in the vaccine group compared to the placebo. But they also unblinded, so a lot more people left the placebo group. The other thing that we also found when we did the paper that's quite important is the number of deaths. So this is 38 deaths in a 6-month period. This is a trial of about 44,000 people. And we expected and in this 6-month period, you expected about more than 200 deaths, about 222. So 38 deaths is only about 17% of the expected figure. So there are a lot of people missing, a lot of deaths that are missing. We expect way more deaths, but they reported 38. And in this trial, there were a lot of people lost to follow-up. And if you read the notes, you will see like they tried to call this person 7 times and nobody's answering. So they put that person as last to follow-up. We don't know if they died. So there's just lots of missing data.
Wow.
Yeah.
This is just incredible. I mean, an entire vaccine mandate
Yeah.
was created
Yeah.
out of faulty data,
Absolutely.
hidden data.
Absolutely. Should outrage everyone. As a doctor, I feel like, they basically destroyed, upended the medical profession. Everybody's, basically parroting this. And if you are just a layperson, you would think your chances of dying if you take the vaccine are less than if you didn't have the vaccine. I mean, the numbers are very small, but it seemed to confer benefit. And if you actually, every time you actually look at the Pfizer data, you got to understand what they presented and what actually happened. So what they presented was 6 deaths up to the data cutoff date of November 14. What actually happened was 11 deaths. And instead of 2 vaccinated, it was actually 6. So now you actually have more people dying in the vaccine group than the placebo group. So it's sort of a reverse of what they were trying to present. And then if you look at it here, this was I've written a lot of letters about this. Now if you look at it, they have had 6 deaths before November 14. They managed to report only 2. So their capture rate for reporting deaths in the vaccinated arm is 33%. But their capture rate for reporting deaths in the placebo, where they managed to report 4 out of 5, is 80%. So in here, you see that the reporting mechanism for vaccinated deaths is different than the reporting mechanism for placebo deaths, because they somehow cannot keep up with deaths in the vaccinated group. They're not doing too bad a job in the placebo group. And if you think about it, the ethical requirements, if you're a clinical trial participant, if something bad happens to you, it is for the safety of yourself and the general population that these adverse events are reported in a very timely manner. So what they were supposed to do, Pfizer was supposed, the clinical trial sites, if there was a severe adverse event, there was a special form that they had to fill to Pfizer's safety, and they couldn't delay it more than 24 hours. So if it was a serious adverse event, they were supposed to tell, the clinical trial site was supposed to tell Pfizer's safety no later than 24 hours. So now, remember, they didn't want this data to be released publicly. But they have more than 500,000 pages publicly available. But that particular data, the data when the clinical trial site tells Pfizer this person has died, that's not publicly available. That data is still missing.
Whoa.
Yep. So we have so much documentation, you're drowning in it, but we don't have still critical pieces of information.
Has there been any effort to get that information through a
No.
lawsuit?
No, so we've highlighted this, but nobody really takes it to another part. So we need more people to actually understand what we're trying to say, because all this, I'm making it very short, but there's been a voluminous amount of writing about it, because we had to show we have all the receipts. So that particular form, at this point, there isn't any lawsuit requiring that that I know of. I'm not sure. Maybe Aaron Siri has asked for it. I'm not aware, but that's why it's important. Because if you think about it, if you had a serious adverse event, right, and you're in a clinical trial, if they say, you got to tell the trial site, if it's a serious adverse event, but if you're still able to tell, you would tell them. But if you died, you can't tell the clinical trial site you've died. So there's going to be some delays. But what we found, so now one thing to understand. So remember I said there were 6 deaths, but they only reported 2. But we only have, out of the 4 that were not reported, only 2 of them have such good paperwork where we have their emergency contact. So telling the clinical site they died on the day they died. So let's talk about this person. So this person's in Kansas, and Kansas, as I understand, has an attorney general who's Republican. He's Chris Kobach. I've actually written a letter to him to tell him about this patient and provide him all the relevant information about this patient, this subject. So this subject is that's her trial number. She's a 63-year-old female. She participated in the Pfizer COVID-19 trial. She was in the vaccinated group. She's one of the deaths that were hidden. So she took a dose. She died on 19th of October. So remember I said the data cutoff date is November 14th. That's like very many days. So imagine, you if you die, you need someone else to tell the clinical trial site you've died. We have, so for two of the subjects, we don't have this exquisite paperwork, and all this is actually found in my letter to Chris Koback. We have the emergency contact telling them they died on the 19th of October. Now, remember, once a clinical trial site gets informed of a serious adverse event, of which death, I'm sure we'll all agree, is a serious adverse event, they are supposed to tell Pfizer no later than 24 hours. By the 19th of October, Pfizer should have known this person died. Yep. Now, something's happened that, yes, the trial site was informed of the death, but they delayed recording the death officially until the 25th of November. Conveniently, it's after the data cutoff date and after they've submitted. So now this is not part of the submitted data. Okay?
Oh.
Right. So, but understand, this is now the meeting to approve the vaccine. This is on December 10th. This is still, now they've officially recorded this. This is not a death that happened after the data cutoff death. This is actually a death that happened here. Right? But they didn't inform. Okay? It becomes important because look at everything that's happened to people and the cardiac issues that have happened. This person, who's 63 years old, she had an autopsy. And her cause of autopsy is sudden cardiac death. And when I went through the paperwork of this subject in her, so a case report form is like a passport to that subject. Everything that happens to them is in their case report form. That's theirs. All their visits, their blood tests and stuff is all there. On the 9th of December, so this is one day before the vaccine approval, the safety database is updated, and there's a researcher asking, is the cause of death unknown? Because the safety database has been updated to sudden cardiac death. So the obvious question is, did they have an autopsy before the vaccine approval, the day before an autopsy? And if you think about it, it's 37 days. By the time they recorded it here, did they have the autopsy already? Do you know what I mean? When did they have the autopsy result? And if you think of all that happened, this person's autopsy result was sudden cardiac death. When did they know? Would the FDA had changed their minds if they had actually been presented this autopsy? Would they have been paused? And the thing is this: there are 500,000 pages out there. This autopsy report is not out there. It's not publicly available. So even though they've put a lot of information on the net, this result is not available.
What does this mean to the bigger picture here?
So
When
if
they
you think
continue
about
to lie.
Yeah, they continue to lie, and they hit. So it's not like they not bad enough not disclosing a death that they should have known by the 20th of October. That's one thing. But they sat on an autopsy result. So this person, imagine if you were this person that you went through a clinical trial, you died, you actually end up having an autopsy, and all this wasn't disclosed when the drug was approved. It was hidden from the regulators.
I still go back to, wow, an entire vaccine rollout was based on these numbers.
Yep. Yep. And that's another one. Okay. So this person is in Kansas. This is another lady. So it's 58-year-old lady. She is another participant. She's in Georgia. So they're all red states, and I'm like just hoping one attorney general will look into this. So this is a lady. She's also in the vaccinated arm of the trial. Took her 2 doses. She died on the 7th of November. Her husband, as I said, we have for exquisite documentation for these two. Her husband informed the clinical trial site of her death 7th of November. And this is where they sort of made a mistake in the clinical trial site, because the clinical trial site admits that they got notification of the death on the 7th of November. So now it all lines up, and then now the clinical trial site actually admits that they were notified of this death on the 7th of November. So by the 8th of November, Pfizer would have known, but somehow this death is first followed up on the 3rd of December. So now this is after the data cutoff date and after all of this. And this is another death that's not disclosed. And this is a 58-year-old woman. She's taking part in a trial of a new drug. It's a novel drug. She dies in her sleep and there's no autopsy. So this is very interesting. I didn't know, like in Savannah, Georgia, you're 58 years old and you die in your sleep, you didn't score an autopsy.
Is that decided on by the families?
I don't know who decided it. I would think it would be you would have an autopsy. I would imagine you would have an autopsy, but she didn't. And so these are US trial participants whose deaths were hidden, and the drug was approved. And the thing about the autopsy is we have to understand, remember I said there were 21 deaths in the vaccinated arm, 17 in the placebo. There were only 7 autopsies done. Even though it was 38 deaths, there were only 7 autopsies done, 3 in the vaccinated arm. But the 10 of the deaths in the vaccinated arm was sudden adult death. That's the other thing I didn't mention before. If you read the circumstances of their death, there are people who died when they were walking, people who never woke up from their sleep, people who the neighbors said, the next apartment's really smelly, you should go and check on them. Yep, the people who were discovered dead in the shower. So these people, 10 of the 21 deaths, they died suddenly. But of these sudden deaths, which would really score an autopsy, they only had 2 autopsies. So one of the and of these 2 autopsies, only one had a result. That one result is the one that was hidden, the one in Kansas. This is one of the deaths of the 10 sudden deaths in the vaccinated arm. This is one of them that has a result. The other one actually had an autopsy, but that result is still pending to this day. We don't know the result. But remember, in the journal article, they said none of the deaths were due to the vaccine. So this person had an autopsy. The result is pending. This person was found dead in the bathroom by his mother. He's 53 years old. His mother must be 80 something. She found him dead in the bathroom. There's an autopsy. The autopsy results not available, but the conclusion is the death couldn't be due to the vaccine. It's laughable. This is the level of science. Like it is farcical.
Yeah, I'm just speechless. I mean, I knew I heard about your group and this data coming out, but I think seeing it just
It's farcical, yeah. It's
yes. And it's just absolutely
horrendous.
astounding
Yeah.
that it's horrendous. Yeah.
Because prior
Okay,
to
go
this,
ahead.
prior to this, I would have thought if you're in a trial and something happened to you, oh my God, you'd be examined you'd be examined,
Mhm.
over-examined. If anything happened to you that was really bad, they'd really be studying it. And then to find out, like, people who died suddenly, they're not even having autopsies. Like, what is happening here? And as I said, like, this is the height of insanity, that someone whose autopsy result is pending, we don't know why he died, but it's not due to the vaccine. Like, it's a joke.
Yes. You know, you could say like one time that, well, it's an accident. They're just not, they're not being thorough. 2
Yeah.
times, it's just a coincidence, but 3 times,
Yeah.
there's definitely a concerted effort
Yeah.
to hide.
Yeah. A
And
lot.
would you say that's exactly what happened?
Exactly. Exactly. They delayed notification of death. They delayed the entry of notification of death, and they didn't do autopsies and they hid them. Even if they did the autopsy, they weren't going to tell you what happened. So
Mm.
I just feel it's a betrayal to the people who signed up for the clinical trial. Like, I'm outraged for them. Like, I'm really, it's such a betrayal to the medical profession, um, and also to the patients who signed up for this trial. I think whatever reasons they had to signing up for this trial, it's a betrayal of that. And
Yeah.
and also then they foisted it on the whole population around the world, and that the egresses in that is terrible as well. So basically, this stuff I've presented it at the excess mortality hearing in the Australian Senate, and I've written to Ken Paxton. I've written to the regulatory authority in Australia about this, so there's some letters there. And then I've written to AG Chris Kobach and AG Chris Carr. So we've been writing a lot, and basically is built upon the work of our paper, the forensic analysis of the 38 subjects' death. So this is pretty much concluding about this hidden deaths, and I can go about the Pfizer's contribution to election interference.
Yes, that would be good. Let me ask before we get there.
Yeah.
What do you conclude? What do you make of Trump bringing Albert Bourla,
Oh,
the Pfizer
Yeah.
head,
Yeah.
into the White House and basically promising more U.S. taxpayer dollars
yeah.
to a company that set up a system that was so fraudulent to collect the data? There's no way you could say it was a mistake. What do you make of this?
I'm speechless at that point. I just you will not, if you don't address the issues that I've highlighted here, you'll never make America healthy again. And
Or
it
great. Or
all
great
great.
again.
Yeah, yeah. And it's such a bit, as I said, it's a fundamental betrayal to the profession of medicine and to the patients. And this is a betrayal on a big scale, but it's so big. I lost my job, and people have been really hurt, and people have died. So it might be that people think it's too hard to handle, and you know not a lot of people, we've written and stuff, but a lot of it's been dismissed. So it's hard to get um the attention of, he probably doesn't know about the hidden debts. I don't think, the thing why I harp so much about the hidden debts is, once you know about it, it's very hard to excuse it.
Yeah.
If somehow
basically,
President Trump gets to know about the hidden debts, that they couldn't, that people died and they hid it, and there were autopsies and they're not available, it's very hard to still be so pro.
Yes.
It's very hard to still excuse it. Do you know what I'm saying? But
Yeah.
it's very hard to get the message about this out as well.
It's because people don't want to hear it because they took the shot themselves
Yeah.
and they don't want to hear this.
Yeah. Yeah.
But what do you think? What do you think, just before we get into the election, what do you think will bridge that gap? Like, what
Well,
how do you talk to people about this?
so what I find is, in the medical profession, 'cause I'm obviously focused on for the medical profession, we obviously not having the conversations. One had to be really understanding. There's a whole lot of information we're not allowed to see to actually start figuring out how these things happened. And so much of the medical profession don't want to have those conversations, because the cost was so high. You lost your job. But
Mm.
for me, what I feel is that if I can show them the fraudulent basis of this, that they hid debts, I see amongst my colleagues on a one-to-one basis, people change their minds. Like it gives them pause because if they hid debts, what else are they hiding? Do you know what I mean?
Right.
So I hope the message about the debts not being disclosed appropriately comes out, because I feel that's one thing that people viscerally can relate to, because the story is an easier story to tell people. I know the DNA contamination is really serious and very important, but it's a harder thing to understand compared to people died, there was an autopsy, and they hid it.
Yes.
They didn't tell the
Yes.
regulator. It was hidden from the regulator. It wasn't when the regulator was given the package at the in November, in the December 2020. These debts weren't there. They only appeared in the 6-month data. But so at the point where they approved the drug, this information was actually not there for the regulator to view, but they died in the period where these debts should have been disclosed.
Wow. Well, let's make it even worse by going into the election.
All right. So now Pfizer had the data. So I think Alex Berenson has actually talked about this as well. And I know at the time, when around November 2020, maybe 2021, even Charlie Kirk was wondering about this, where, like the whole timing of the vaccine announcement. Was there, did Pfizer hide, like delay their vaccine hearing? And I know that Jim Jordan's committee was actually looking at it, though I think when I look at follow-ups, I don't know whether there's been too much movement on that. And especially now that, Pfizer's got a big contract, I don't know whether there'll be any movement on that. But at the end of the day, it's if you think about it, a pharma company and US elections. Like, was it so powerful to actually not disclose? And it went against the contract. So that's what I try to go back to. Pfizer signed a contract with the US government that they had to actually provide a vaccine by 31st of November 2020. That's why during the election debate, President Trump said there'll be a vaccine before the election. And there was a lot of pushback on that. And if Pfizer couldn't provide the vaccine by the 31st of October 2020, they had to actually how do I put it? Any modifications on that contract had to be done in good faith. So the thing is this: ultimately, there was a contract. It wasn't fulfilled because there wasn't a vaccine. There obviously had to be modifications. That modification really just appears, but the terms of the contract modification are not public. But one has to wonder whether it was done in good faith. So now, Pfizer had the data to announce its COVID-19 vaccine in October 2020. Why did they delay it? That's a question we ask the reader, and we present the data. Now, if you think, Pfizer said that the vaccine, when they got approval, was 95% effective. So this trial had about 44,000 people. Do you know that 95% effective claim? Do you know how many people it was based upon? Based on the results of 170 people, just 170. Yep. So based on 170 people, so that's why I was like, when I started looking at the Pfizer data, I was like, I lost my job because of these 170 people. I don't have anything against them, but I just couldn't get over it. I'm like, I'm about to lose my job. Like, if you think about how long it takes to be trained to be an anesthetist, I'm about to lose my job over 170 people's results. But anyway, basically, how to show a vaccine is effective is you compare the incidence. We basically compare the how many people got an infection in the vaccinated group versus how many people got an infection in the placebo group. Okay. And these 170 were basically called the primary evaluable population. They were the most important uh, population in this trial because it's based on their results. You can't say a vaccines, you can say, the safety data was based on 44,000 people, right? Of the basically the whole population in the trial. But the efficacy claim, the thing to say that it was effective, was only based on 170. So you can't really approve a drug to be effective if you don't have the results of the efficacy. As much as safety is an important thing, you need to actually show it's a working drug. Do you know what I'm saying?
Yes.
So basically, these people had to go through the trial perfectly. They couldn't have had any COVID beforehand. They couldn't actually have any COVID until 7 days after dose two, and they couldn't have any protocol deviation. So now, basically, so the statement of work is the contract between Pfizer and the U.S. government. And remember, I said when you look at the or anything, you have to actually see what Pfizer tells the world, and then you have to actually analyze what Pfizer has. So this is a graph of the when those 170 people got diagnosed. Okay. Now, basically, remember I said you had to have 2 doses and then 7 days after dose two. So basically, when the trial started, and that was the 27th of July, this is the first possible case for the primary endpoint. And this is the contract delivery date, 31st of October. And I just put 61 cases and I'll explain why. But basically, this is a derived value. This is what I'm saying because they must have said something that they didn't fulfill their contract. But this is basically what they said publicly. So basically, and this is the press release that they put out that on November 8th, they did um they have demonstrated that they have 94 where's the case, yeah, they reached 94 cases. So this is November 8th, they reached 94 cases. So let's just read their press release. So after discussion with the FDA, the company recently elected to drop the 32 case interim analysis. This is how many cases that are suitable, and conduct the first interim analysis at a minimum of 62 cases. So that's why I said when they actually passed the contract date, it had to be less than 62 cases because they never analyzed anything on the 31st of October 2020. Now, after they completed these discussions, they miraculously reached 94 cases, and then they did their first data analysis. So we go back here. Now, this is the world according to Pfizer. We reached 94 cases on the 8th of November. Remember, they had a contract that was due on the 31st of October. They didn't fulfill it. They said they were looking out for 62 cases. They must have never found 62 cases. They miraculously found 94. And then from this first date, they could actually have a case to here. This is like the slowest accrual of cases ever known. It's like slow, 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 slow. But suddenly it's like zoom, 170. It's a miracle. This is like
Whoa.
12 cases a day from 94 to 170 because suddenly they actually aim for 164 cases, but they found 170 and they stopped because that's all they needed. They already had a schedule in the protocol. This is how many cases we need. And if we reach this many cases, we can declare we have an efficacious vaccine. So that was reached on November 14, and then the data cutoff date was that. Okay. Now, so this is a very slow accrual, less than one case, no COVID happening here. Because remember, the end point was that this was to see who got COVID infection. So, and this is both placebo and vaccinated. But then now we've got 94 cases, and then suddenly, zoop, there's so much COVID happening here. Everybody's being diagnosed with COVID left, right, and center. It's 12 cases a day. But we found the exact 170. So this is the real 170 people, and we plotted out when their cases were diagnosed. Okay. So now, if you look at this, is what they said. Yep. And then remember, we can't have a vaccine before the election day. We only, we couldn't do an analysis when we reached 62 cases. So after we finished talking, we are doing an analysis when it's 94. This is the real cases they had. We found the exact 170 patients, and we looked up when they were diagnosed. And look at this here. Remember, they said we couldn't do it at 62 cases. This is before the election, and they actually have 94 cases. So when they tell the world, I've got 94 cases on the 8th of November, they had 94 cases at the end of October. And when they
Wow, so they actually met their deadline.
Yeah. And when they actually tell the world they had 94 cases, they were sitting on 134. Because if you look at the accrual of the number of cases here, it's a bit more gentle. It's not like zoop. It's like so to come from 134 to 117 these few days wasn't so bad. But you were having enough cases here way before the election. And the thing is, 94 cases wasn't exactly the threshold they wanted. It wasn't exactly what they mentioned in this press release, right? They said they will conduct the first interim analysis. They dropped their criteria at 32 cases, and they will conduct the first analysis when they reach 62. So the question is, when did they reach 62? And that's what I wanted. So they reached 62 somewhere here. So it gets even earlier. They opted not to do any analysis. They sat on it. They reached their deadline. They breached the contract. They already reached this, and then suddenly here. And if you think about it, Joe Biden's declared president November 7th. It's not even after the election. It's Joe Biden was declared president November 7th. November 8th, they do the first data analysis.
Wow.
Yeah. So
Wow. So they actually met their goal probably early October. I can't quite see
the date. I'll have the dates there.
Okay.
So basically,
Wow.
this is now, remember, this is everything that comes out in a press release is pretty important, because that's the thing that meets the legal threshold. Like when they had a contract with the Trump administration, and at that time it was $2 billion, and they had to deliver efficacious vaccine by 31st of October 2020. And then the next thing you know, the contract's been changed to $10 billion. And that was in December. Okay. The only thing that happens in the contract modification, all of this is found in that report. You can go to the report and find it. The report's freely available. Only thing that came out there was the 170 patients. They were the only patients that mattered. They were the only patients that made it into the contract modification from 2 billion to 10 billion. And now, remember, they said they would do the first interim analysis at 62 cases. And remember, I said 62 cases is somewhere here. This is 22nd of October. But look at what they're doing in the protocol. So in the protocol, also on the 29th of October, this is the Pfizer's protocol. This was probably their signal to the Trump administration. You're not, remember, all this is secret, yeah? This was not supposed to be made publicly. This is them telling the Trump administration, you're not going to get a vaccine, and we're going to probably not be able to fulfill the contract. For operational reasons, we removed the interim analysis at 32 cases. We clarify, we'll do the interim analysis after accrual of at least 62. They are putting this in the protocol on 29th of October, when they've actually had here. They reached 62.
So
When they are sending the protocol, they had 90 plus cases. And they're telling everybody,
So there's
be,
hard evidence they were lying
yeah,
to the president
yeah,
about the efficacy,
yeah,
and they were planning very clearly to release it after the election.
yeah. But, yep, yep. And as I said, I'm not making this up. This is the contract, 31st of October 2020. And the best part, in order for regular reporting requirements, Pfizer shall use diligent efforts to notify the government of any event, risk, formal, informal, FDA communication, or otherwise would reasonably expect to materially change the anticipated schedule by 1 week or more. This is in the contract. That's why I say, at the end of the day, whatever it is, you got to go back to the contract. This is how you can, like, if they wanted to look at it, they could, because as I said, if you actually find the real 170 people, there's a discrepancy. There shouldn't be. These two lines should follow each other. There's a big discrepancy. And if you go back to the contract, Pfizer, if there was even going to change by a week, they should have. So what? And remember, I said at the beginning, contract modifications had to be done in good faith. They had to tell if there were any delay by a week. They had to tell. What did they tell? That information is not publicly available. So now, remember, they said 32 cases, they were not going to do the interim analysis. So this was if you read and stuff like, they will say that, even in Albert Bourla's book, because he talks about this, at this point, if you think about it, you want to create an efficacious vaccine the fastest you can. Yeah. At this point, the vaccine was 100% effective because there were no vaccinated people who actually got infected at this stage. All these 32 people were the placebo. So what happened? I'm just throwing it out there, that they denied an efficacious vaccine to the population and didn't do an interim analysis when the vaccine was 100% effective. And this is when they reached 63 cases on the 22nd of October. They are amending the protocol. At this point, the vaccine is actually 96% effective. And they are amending the protocol on the 29th of October, and they have like 90 plus cases. That's the thing they should be that's why I say Pfizer had the data, they sat on it, and what they presented publicly to the world is, oh, we've got 94 cases, and then suddenly, zoop, we've got 170. We are closing the trial, we're sending it to the FDA, and we're going to get this drug approved.
Wow. They should not be brought into the White House and be given more of my money.
No.
They need to be sued and taken out of the United States.
And you should go after them for the contract, because here it is.
Absolutely.
The contract is there, and it's in plain white, black and white. They amended the protocol here. They would do it when they reached at least 62 cases. When they amended the protocol, they were sitting on more than 62.
That's right.
Yeah.
Amazing.
Yeah.
Well, this is amazing to see.
And that's my last slide. This is my last slide, just to talk about where you can find our work. And I'm going to stop the slideshow.
As far as you know, is any country going after Pfizer regarding this fraud?
I don't think so. Do you know of any?
I don't think so.
Yeah.
I mean, there's been rumblings in Europe, haven't there?
In the European
there's-
Parliament, but
there's
nobody's
just been-
actually litigated. Yeah.
Correct.
Yeah.
That needs to happen, and happened yesterday.
Yeah. I think if you're in Kansas and Georgia, like, there are dead bodies in that state that, should be investigated.
Why is it important for people to and I've asked this before, but I'm going to ask it again. Why is it important for people to understand this now and act on it now?
It'll happen again. If you don't hold people
Yeah.
accountable, it'll happen again. And it's what they did was so big. This is a company that has interfered with the elections in your country. You know,
That's right.
it should never, as I said, during the pandemic, it became so everything medicine was it became so poisonous. The practice of medicine should have never been politicized. They should have just allowed doctors to do what they do. The FDA should have just, it should have just approved the drug when they had an efficacious drug. Instead, they're discussing and saying, oh, we're not going to do it at 32 cases when the drug's 100% effective. So now, if you think about it by their way, what was their justification for withholding from the population 100% effective drug? All this became too politicized. All politicians should be out of this. Let doctors be doctors. Let doctors treat patients to the best of their ability. But it's been so powerful. It took away my job. It cost, it's caused immense. Um, there's no accountability. They can do this again.
Yeah. I mean, we're talking about stripping people of their constitutional rights,
Yep.
their God-given rights, the attempt to strip them of those.
Yep.
Um, it's just plain murder.
Yeah. And there's and no
Because
accountability to
more
the
people died.
Absolutely. And no accountability to the platform itself, the mRNA platform. A lot more investigation needs to be done to the safety of this platform before there's any other drug foisted onto the population. And did I mention that, the US, like, if they suppressed vaccine efficacy results around the time of a US election. Like, that's pretty big.
Yes, especially as Trump's platform was Operation Warp Speed, getting it out as soon as possible. That
Yeah.
was his
Yeah.
2020 platform.
Yeah. I think
Well,
I don't blame President Trump in a sense like he's not a doctor. And I truly believe that he was trying his best for people. But at some point, what he's doing now in terms of maybe he can't admit he was wrong, but this has caused so much harm to people. The whole process was, so distorted and warped. And there needs to be accountability.
yes. Do you think it will come?
I have no idea. Like we can only try, and ultimately, at some point, they should hopefully there is some, but they're very powerful forces. Um, but there needs to be for the people who, like, for me, the people who, like, these two hidden deaths, like, they were the first victims in all of this, and nobody's there to tell their story. And there needs to be accountability. It's for me, it's such a betrayal of their altruism in signing up for this trial, and that they were treated so badly. Like, they went through a trial,
Yes.
they died, and their deaths were hidden. Like, this is so disgusting. It's a terror. And it's like, as a doctor, I feel terrible for the subjects. Like, I just feel it's yeah. As I said, for the entire profession of medicine, it's been a desecration.
Yes. Well, this has been a very meaty and fascinating and hard to hear interview today. I'm sure everyone's like, wow. I have one question for you that I ask everybody. If the average American citizen could do one thing to combat the corruption that they see in our country, what would it be?
Be involved. It's painful, isn't it? It's painful. It's hard. But we need to be involved for all our sakes. Like, we need to not think this is too hard, way above me, too powerful. This is about all of us. Like, all of us deserve safe medication. All of us deserve to have high trust in the process. And right now we don't have it, but we need to push back and ask for it. We deserve it.
That's excellent. Well, Brett Weinstein of the Dark Horse podcast recently was talking about when there is when truth is obscured, when you can't trust anything.
Yep.
Can you have true freedom?
No. No. We can't.
And why do you think?
Because there's no you don't know what to trust, you don't know what you're doing. I think everyone's just lost. And I think for a lot of people, how do I put it? Before COVID, before I was like, I don't understand what's happening. I don't understand why the medical profession, like this, before my eyes were open, I basically went around thinking I'm doing my best. Whoever's in this field is doing their best. So you're not aware of the corruption, but you think you're making a choice, but so much of it is so controlled, and you've no idea. You've no idea how much you've surrendered, and you've come to the fundamental point where willingly, knowingly, you have no control over what goes into your body. How are you free if you can't even say no to something you don't want?
Yeah,
That's like the first. It's like
that's right.
it's so fundamental. Like, and one of the reasons why I stood up was like, I felt like if no doctor stands up, like later on when the truth comes out, there'll be such a like the public will be feel so betrayed with the medical profession. And I did it for the people who basically rolled up their sleeve and just took it in full faith of the medical profession. And but it's been so convoluted and so betrayed. And I just thought somebody had to make a stand. And if I have 4 degrees in medicine, and if I can't get informed consent, and the Premier of Victoria decides he's going to make medical choices for me, and I have like no choice, no one's free. And even if you had 0 degrees, you should still be able to make a choice about what you want in your body. And it's just so fundamental. And as I said, like I come from, like, if you just understand history and why we have informed consent in the first place, but what happened in World War II and who actually did it. Like a lot of the SS officers were doctors, and then why we have the concept of informed consent. So I couldn't sit there and I couldn't believe, like, the president of the AMA, the Australian Medical Association in Victoria, said that in a pandemic you have to give up some rights. And I'm like, I don't even have the best reading of history, but I pretty much know that's a very slippery slope to say you have to give up.
Yes, it is.
Like, I'm just sitting here thinking, I just don't understand how this is happening, but I know it's not right.
Thank you so much for the work that you have done combing through these records of Pfizer and putting them out to the public, and your continued advocacy on behalf of the people harmed, which is everyone was harmed, the entire world. Thank you on behalf of Feds for Freedom to you and your team. You have done a lot of wonderful work.
Thank you so much. And thanks to our team as well. And thank you for this opportunity to talk about our work. Thank you, Stephanie.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.